Mindfulness-based cognitive therapy. MBCT, a mindful approach to depression and anxiety. Experience of recent depression and anxiety can leave one feeling exhausted, uncertain about how to move forward, or get unstuck, and like life has lost its color. There are evidence-based approaches that are effective and empowering to help you break free from the patterns that contribute to repeated and prolonged episodes of depression and anxiety. MBCT, mindfulness-based cognitive therapy, combines training in mindfulness meditation practices with principles from cognitive therapy. The heart of this work lies in becoming acquainted with the modes of the mind that often characterize and contribute to mood disorders, while simultaneously learning to develop a new relationship to them. Cultivating mindfulness often offers possibilities and potential for living a life in a new way, for learning new skills, and wholly new ways of working with and befriending your mind. So there's mindfulness-based cognitive therapy on the side, and then mindfulness-based stress reduction on the other, and then how they meet in the middle. So where they meet in the middle. Mindfulness awareness is the foundation of both programs. Paying attention to experience, thoughts, emotion, and the body are central for mindfulness skills. There are 8-week structure, 2.5 hours per session, 1-day silent retreat, group format with home practice exercises, debriefing practices to increase wellness, and sessions include meditation, informal practice, and mindfulness movement. And some of the ways that mindfulness-based cognitive therapy is different. It prevents depressive relapse, treats depression and anxiety, enhances awareness of negative states, builds self-care, uses mindfulness and CBT exercises to shift unhelpful attitudes, explores patterns of thinking, emotion, and behavior, emphasizes choice in responding to distress, and develops skills on what to do when low moods and anxiety rises. Mindfulness-based stress reduction, on the other hand, is for the general population. Acute or chronic stress, examines the effects of chronic stress, uses mindfulness to teach healthy responses, reduces avoidance and maladaptive coping skills, emphasizes waking up to being present, and develops skills on what to do when stress arises. So, how does MBCT work? Mindfulness practice helps you to see more clearly the patterns of the mind and to learn how to recognize when your mood is beginning to go down. This means you can't nip it in the bud. You can nip it in the bud much earlier than before. Mindfulness can help you interrupt the automatic connection of negative mood, negative thinking, and bodily sensations such as fatigue and sluggishness that often link, trigger, or react a downward mood spiral. Mindfulness allows you to shift gears from a mode of mind dominated by critical and judgment thinking to another mode of mind in which you experience the world directly, non-conceptually, and non-judgmentally. Mindfulness offers access to another approach to dealing with difficult emotions and moods. Through mindfulness, you can discover that difficult and unwanted thoughts and feelings can be held in awareness and seen from an altogether different perspective. A perspective that brings with it a sense of warmth and compassion to the suffering you're experiencing. Mindfulness can help you learn how to be present and appreciate the simple pleasures of everyday life. Connect with yourself and the experience of being alive. Background of mindfulness-based cognitive therapy. NBCT is a relatively new therapy approach developed by Siegel, Mark Williams, and John Tesdale. Their work is based off earlier work of Tesdale, John Kabat-Zinn, and Philip Bernard. John Kabat-Zinn founded the mindfulness-based stress reduction program in the 1970s. He included Buddhist principles into his work with medicine and science. Around the same time, Marsha Linehan developed dialectical behavior therapy with spiritual influences in the mind. Stephen Hayes, Kelly Wilson, and Kirk Strausel also incorporated spiritual practice into their model called acceptance and commitment therapy um, in the 1980s. The first clinical study of mindfulness-based cognitive therapy was published in 2000. It was designed as an 8-week program to help people cope with the toll that health concerns take on you both mentally and physically. The goal of mindfulness-based cognitive therapy. MBCT practices help you recognize early signs of depression. If you're aware of your emotions and have proper coping skills, you can prevent a relapse of negative thoughts. So this is just some of the things on this diagram I found that's like the goal of cognitive therapy. So you have increases empathy, decreases emotional reactivity, increases cognition, may help lower blood pressure, bolsters cognitive flexibility, reduces stress, improves relationship satisfaction, restores childlike wonder, improves quality of sleep, supports working memory, boosts immunity, and helps manage chronic pain. The impact of mindfulness-based cognitive therapy on your health. Your thoughts can greatly affect how you act and feel. When you're equipped with the tools to manage your thoughts, you can reduce the amount of negative thoughts that take over you and influence your life. Eliminating being a dilemma. One of the underlying issues that affect depression is being unable to solve problems. If you don't see a solution to a problem that's bothering you, negative self-talk begins. This leads to a downward spiral of depression that's difficult to get out of once you're in it. MBCT can help you learn not to try to get rid of the problem, but rather accept it. Accepting your thoughts. Mindfulness means that you give your thoughts space without pushing them away. When you're able to address a negative thought without allowing it to affect you emotionally, you have better cognitive function. MBCT gives you the tools to allow thoughts to pass through your mind and move on.